Today, we're going to talk about the diseases and physiological stress of the endocrinology. So, there are several endocrine system diseases that result from disruption in the complex system. Some are as follows. First, the adrenal insufficiency or Addison's disease. Second, Cushing's syndrome. Third, diabetes mellitus. Then fourth is the growth disorder. Fifth is the thyroid disorder. So first, we're going to discuss about the adrenal insufficiency. So what is adrenal insufficiency? Adrenal insufficiency is an endocrine or hormonal disorder that occurs when the adrenal gland do not produce enough or of certain hormones. It refers to any situation in which the level of cortisol are chronically lowers than normal. There are two types of adrenal insufficiency. We have primary adrenal insufficiency and secondary adrenal insufficiency. Recall, what is production of cortisol? This is the production of cortisol. You can view the pics. So, primary adrenal insufficiency, also referred to as Addison's disease, occurs when the adrenal gland are damaged and cannot produce enough of the hormone cortisol and often the hormone aldosterone. So what are the cause of Addison's disease? The common cause is due to the autoimmune attack in which immune system mistakenly recognize some components of a person's own adrenal cells as foreign. It is due to loss of adrenal cortical function, which may occur, for example, when an infectious disease such as tuberculosis, HIV, or fungal infection infiltrate the adrenal gland and destroys them. Sometimes there are also tumors. So, what are the symptoms of the Addison's disease? The symptoms are imbalance of sodium, potassium, and water in the blood, hypotension or low blood pressure, chronic diarrhea, darkening of the skin, patchy skin color, paleness, extreme weakness, fatigue, loss of appetite, mouth lesions on the inside of a cheek or buccal mucosa, nausea and vomiting, slow, sluggish movement, unintentionally weight loss, and salt craving. So, how is Addison's disease diagnosed? The diagnosis is made by measuring plasma concentration of cortisols. Tests may also show increased potassium level, low blood pressure, low serum sodium. However, sex hormones will be at normal levels. Addison's disease may be misdiagnosed as chronic fatigue syndrome or even as a physiological disorder because some patients may exhibit anxiety or emotional problems. The treatment of this is that this disease requires daily oral administration of glucocorticoids and mineral corticoids. Also, the patient must carefully monitor his or her diet to ensure adequate consumption of carbohydrates and controlled potassium and sodium intakes. The secondary adrenal insufficiency can be traced to a lack of adenocorticotropic hormone or ACTH. Aldosterone production is usually not affected. So what is ACTH? ACTH is a polypeptide tropic hormone produced and secreted by the anterior pituitary gland and is produced in response to biological stress. Its principal effects are increased production and release of corticosteroid and, as the name suggests, cortisol from the adrenal cortex. So what are the causes of it? A temporary form of this disease may occur in a person who has been taking a synthetic glucocorticoid hormone for a long time and then stops, either abruptly or gradually. Glucocorticoids block the release of both ACTH and CRH. Another cause of it is the surgical removal of the non-cancerous ACTH producing tumors of the pituitary gland that cause Cushing's disease. Well, we have the points to remember. The adrenal insufficiency is a disorder that occurs when the adrenal gland do not produce enough of the hormone cortisol. Primary adrenal insufficiency, also called Addison's disease, occurs when the adrenal glands are damaged and cannot produce enough of the hormone cortisols and often the hormone aldosterone. The secondary adrenal insufficiency occurs when the pituitary gland fails to produce enough ACTH, a hormone that stimulates the adrenals to produce cortisols. If ACTH output is too low, cortisol production drops. The Cushing syndrome is a hormonal disorder caused by prolonged exposure of the body's tissues to high levels of the hormone cortisols in the blood, even in a non-stressed individual. So what are the causes of it? Due to primary effects, e.g., a cortisol-secreting tumors on the adrenal gland. Due to secondary effect, usually due to ACTH-secreting tumors of the pituitary gland. It may cause because people take glucocorticoid hormones. May be caused due to overproduction of cortisol in the body. Symptoms and effects of Cushing syndromes. The symptoms and effects of it is that the increased catabolism may produce such a large quantity of precursors for hepatic gluconeogenesis that the blood sugar level increases as observed in diabetes. The increased blood levels of cortisol tend to promote uncontrolled catabolism of bones, muscle, skin, and other organs. The bone strength diminishes and can lead to osteoporosis. Muscle weakens and skin becomes thin and easily bruised. There is a possibility of immunosuppression, which is brought about by the anti-immune action of cortisol. It is associated also with the loss of fat mass from the extremities and with the redistribution of fat in the trunk, face, and back of the neck. Obesity can occur. A possibility of developing hypertension due to the pharmacological effect of cortisol, including cortisol's ability to potentiate the effects of epinephrine and norepinephrine on the heart and blood vessels. Most people have severe fatigue, weak muscles, high blood pressure, and high blood sugar. Women usually have excess hair growth on their faces, necks, chests, abdomens, and thighs. Their menstrual period may become irregular or stop. Men have decreased fertility with diminished or absent desire for sex. So it can either bring emotional disturbance, enlarged silica torcisa, moon phase, osteoporosis, cardiac hypertrophy or hypertension, buffalo humps, obesity, adrenal tumor or hyperplasia, thin, wrinkled skin, abdominal stray, amenorrhea, muscle weakness, purpura, skin ulcer, poor wound healing. So what are the treatments of it? Treatment depends on the specific reasons for cortisol exist and may include surgery, radiation, chemotherapy, or the use of cortisol-inhibiting drugs. So let's talk about the diabetes mellitus, often referred to as diabetes. It is a group of metabolic disease in which a person has high blood sugar levels, either because the body does not produce enough insulin or because cells do not respond to the insulin that is produced. There are three main types, which is type 1 diabetes, type 2 diabetes, and gestational diabetes. So what is insulin? Insulin is the principal hormone that regulates uptake of glucose from the blood into most cells, primarily muscle and fat cells, but not central nervous system cells. Insulin is produced by special cells called beta cells in the pancreas. Pancreas is found behind your stomach. Therefore, deficiency of insulin or the insensitivity of its receptors plays a central role in all forms of diabetes mellitus. Insulin is also the principal control signal for conversion of glucose to glycogen storage in the liver and muscle cells. So, what is type 1 diabetes? type 1 diabetes mellitus is characterized by the loss of insulin-producing beta cells of the islets of Langerhans in the pancreas, leading to insulin deficiency. This type of diabetes can be further classified as immune-mediated or idiopathic, where beta cell loss is a T-cell mediated autoimmune attack. Beta cells produce little or no insulin, and as a result, glucose builds up in the bloodstream instead of going into the cell. So this is the type 1, this is the producing of the type 1 diabetes. The stomach changes food into glucose, where glucose enter the bloodstream. Then when they enter the bloodstream, goes to the pancreas makes little or no insulin. Then after that, little or no insulin enters the bloodstream. Then 5-glucose builds up in the bloodstream. So what is type 2 diabetes? Type 2 diabetes mellitus is characterized by insulin resistance, which may be combined with relatively reduced insulin secretion. The insulin receptors are believed to be the defective responsiveness of body tissue to insulin. Due to the insulin resistance, which means that the fat, liver, and muscle cells do not respond correctly to insulin, the blood sugar does not get into these cells to be stored for energy. When the sugars cannot enter cells, there are high levels of sugar build up in the blood. This referred to hyperglycemia. In the early stage of type 2 diabetes, the most predominantly abnormality is reduced insulin sensitivity. Hence, at this stage, hyperglycemia can be reversed by a variety of measures and medication that can improve insulin sensitivity or reduce glucose production by the liver. The type 2 diabetes usually occurs slowly over time, and most people with this disease are overweight. Increased fat makes it harder for your body to use insulin the correct way. So, this is more like the process of the type 2 diabetes. The stomach and the pancreas. Then, the stomach converts food to glucose, which glucose enters to the bloodstream. Then, pancreas produces sufficient insulin, but it is resistant to effective use. Hence, the glucose unable to enter the body effectively. Then, 5-glucose level increases in the bloodstream. So, what is gestational diabetes? This type of diabetes only occurs in some women during pregnancy. For moms to be, the body need additional insulin, therefore the pancreas dutifully secretes more of it. However, if the pancreas can't keep up with the increased insulin level, the blood glucose level rises too high. Between 2 and 10% of expectant mothers develop this condition, making it one of the most common health problems in pregnancy. Most women don't remain with gestational diabetes after pregnancy. Once someone has had gestational diabetes, she at a higher risk for getting aging during future pregnancy and for developing diabetes later in life. If untreated, gestational diabetes can damage the health of the fetus, and such risks include macrosomia or the high birth weight, congenital cardiac and central nervous system anomalies, and skeletal muscle malformation. So, gestational diabetes is more on the pregnant women, which high blood glucose levels in mother bring extra glucose to baby, cause baby to put on extra weight. So, what are the signs and symptoms of diabetes? Symptoms may develop rapidly, weeks or months in type 1 diabetes, while in type 2 diabetes, they usually develop much more slowly and may be subtle or absent. Classic symptoms are polyuria, frequently urination, polydipsia, increased thirst, and polypalgia, increased hunger. changes in the shape of the lenses in the eyes, resulting in